All right, so now today we're here with Danielle. She's a second year medical student at University of Illinois in Rockford, and she's going to present her work on a research project that she's been diligently working on related to breast implant illness. Actually has funding through the university, so with that, I'll let her take it away.
Hello everyone, thank you for having me. To start, I'd like to touch on a little bit of background about my study. So CD30 is a receptor that's found on both T cells and T regulatory cells. Its function particularly is involved in the two-signal model in order to start inflammatory processes and anti-inflammatory processes within the body. And it does this by interacting with its co-receptor CD30L that is found on dendritic cells. And so for our study particularly, we are interested in CD30 and CD30L interaction corresponding to its attachment to T regulatory cells. Looking at the literature, it says that CD30 and CD30L interaction plays a role particularly in transplantation tolerance and graft versus host disease. In fact, in a specific study, as you can see here in 2007, researchers inhibited the interaction of CD30 with CD30L, and then there was an inability to control the ongoing inflammatory reaction within the body. So what this is basically telling us is that CD30 and CD30L play a very important role in suppressing inflammation within the body, and it is very important in regulating and preventing autoimmunity that can further occur. But as Dr. Pryor mentioned, we are specifically looking at serum CD30 in the body. And so serum CD30 is the extramembranous region of the CD30 receptor once it gets cleaved by a metalloprotease. And when this occurs, it basically circulates in the tissue and can be released into the bloodstream where it can be measured. The problem with this, however, is serum CD30 can still attach to its CD30L receptor. And when it does this, it blocks further interaction with the CD30 receptors that are still attached to the T regulatory cells, which means that anti-inflammatory processes cannot occur. So researchers have been exploring this interaction and this blocking and in autoimmune diseases. And what they found is that in Sjogren's, rheumatoid arthritis, lupus, Wegener's granulomatosis, Graves' disease, and Hashimoto's disease, there's a significant increase in serum CD30 during these disease processes. But this has yet to be studied in breast implant illness. And so what we would like to do in our study is analyze serum CD30 levels both before and after explantation surgery in our breast implant illness patients, with a hypothesis that serum CD30 levels will be significantly increased in patients prior to their explantation surgery, and then we will see a significant decrease after their explantation surgery. And if this hypothesis holds true, implications for this study will allow us to better learn the etiology of breast implant illness and the pathways that are occurring in the body. It'll also allow us to better understand breast implant illness's relationship to other autoimmune diseases and potentially lead us to a diagnostic marker in breast implant illness, which would be very helpful for future patients. The overall impact that this disease truly has on its patients, and that it's still a diagnosis of exclusion, which basically means that we don't have specific criteria to diagnose breast implant illness, and there isn't a diagnostic marker. But that, research is still ongoing, and so I think that when you learn about the impact that it has on its patients, it's really kind of like a push to get you involved and get you to ask questions and get you to look into the illness more. Currently, our study is still ongoing. If you have any questions or comments, feel free to contact me at the email address listed here.